Good afternoon, everybody. Dr. Nick Coatsworth with today's top three, and I have my friend and colleague Dr. Vanessa Johnston with me today as our guest. Vanessa's an old friend from the Northern Territory days and is now the Deputy Chief Health Officer at ACT Health and also a public health physician. And my shout out today goes to anyone in Victoria and New South Wales who has actually been diagnosed with coronavirus disease, who is COVID-19 positive and has received a call from the public health unit to do some contact tracing. Because the contact tracers are going to ask you all sorts of things and ask you to remember things, ask you to do things. And today we're going to run through with an expert in that field exactly how that process goes and answer some of your questions about contact tracing. So maybe a straightforward one, Vanessa, to start.
Yeah.
Is our privacy protected with contact tracing?
Yeah, absolutely. As with the collection of any health data, there are very strict protocols, legislative instruments in place here in the ACT and around the country to protect patients' confidential data. So you can be reassured that that data is held very securely and it is confidential.
Fantastic. Critical to know. Now, contact tracing, I mean, you've done a lot of contact tracing in your time. It's a pretty detailed process. Can you talk us through it along with some of its limitations, perhaps, or things that take a little bit of a while? What does someone expect when they get a call from a contact tracer?
Yeah, okay. Well, I guess the first thing is to know that the ACT Health or the Jurisdictional Public Health Unit is first to be notified in general of a person's notifiable disease, because that notification comes straight from the laboratory. It's the quickest turnaround time, so we don't wait till that test result gets out to your GP, notifies you, and then comes to us, because then we've got a length of time where you may not be in isolation. So it comes straight to us. So we give you a call. You'll know that you've had a test. You've been asked to isolate at home until you get a test result. So that's the first thing. And some people can be quite shocked or upset that they actually have the disease. So we need to sit with people for a little while and work through that with them. What does it mean for their household contacts, their family? What can they expect from the disease progression, etc.? So we work through that. And then we have to understand where they may have got this infection from. So we know that the incubation period for this virus is for up to 14 days. So we have to track that 14 days and ask them all about their movements. Now, sometimes it's relatively straightforward. They may be a household contact of a known case. So we know that they've got the disease from a household contact, and that's where most transmission does occur. It's within close household contacts. Other times it's not as straightforward, and I think that's really where the detective work can come in. And really it can take a number of hours and actually multiple interviews for people to remember exactly where they've been. We need to know whether they've been on public transport, where they've been shopping, where they've been out to friends or visiting family, if they've been in educational settings. So we're really also interested in high-risk settings, whether they've been to hospitals or aged care facilities, but we want to know about all of their movements. So that's really what we're trying to do, but it can take a lot of time. And then we have to understand who they may have been in touch with during their infectious period. So we have to understand their symptom onset, and then we work back 48 hours, because we know that some people can be infectious up to 48 hours prior to their symptom onset. And then again, we have to understand where have they been, who have they been in contact, and ascertain who their close contacts are. And they're people that they've spent 15 minutes face-to-face with them in a cumulative period over a week, or 2 hours or more in an enclosed space, like a bus or a lecture theatre or something like that. And then we collect all of those names, and then we do another round of phone calls.
Wow. So that's really important for people to understand, I think, that there's basically two things that are going on with this disease detective work. You need to track back that 14 days to see if you don't know who they got it from.
Yeah.
You need to try and find, and that's the transmission chain.
Yeah.
And then you've got to know for the time that the individual who's COVID positive was actually infectious, who they might have passed it to.
Yeah.
So that's a whole heap of work.
Yeah.
And then that third piece, again, as you say, going and finding those contacts and giving them a call and saying, what do you say to them when you call the contacts and say you might have been exposed?
Yeah, so when we call the close contacts, we know that the most important thing for close contacts is that they get into quarantine. So that's basically where you're self-isolating at home, but you're otherwise well. So, they can be at work, they can be at school, and we're basically giving them a call and saying you need to get home. You need to be vigilant for symptoms. You're going to be there for 14 days. You can't leave unless you need to seek healthcare. And we'll be contacting you every day to see if you've got symptoms and whether we need to get you tested. So that's right, Nick. It's 14 days, back from symptom onset, and then 2 days back from that to work out the infectious period.
So, keeping in mind that degree of work, I guess the last question is, will the approach to contact tracing change the more people are getting the virus? What's going on in Victoria at the moment, and how is the nation sort of helping them with their contact tracing?
Yeah, well, I think as more, because these interviews can take so long, and it can also be quite difficult in the first place to get hold of someone, I think as numbers increase, the experience in Victoria is showing that what they're trying to do is send out a text message or do a short interview in the first instance to say, hey, you're positive, try and identify any high-risk exposures and get them home into isolation and say, we're going to be ringing you back to ask you a whole lot more questions. But if we spent all of that time up front on the phone with these people, they wouldn't be getting to the hundreds of other people that are being notified in a day. So the economies of scale, they're starting to work out more efficient methods to make sure that people are in isolation as quickly as possible. And they're leaning on their jurisdictional colleagues, public health units, to give them a hand, and basically giving other people across the country lists of names to help them get in touch remotely.
So that's a really critical point, I think, that people might not be aware of when they see these numbers and think, wow, how is Vic Public Health managing this? It's actually with the remote assistance of people like yourself all around the country, whether it's Western Australia or particularly up in Queensland. I know South Australia as well, all those jurisdictions are sort of mucking in to help. Yeah,
and some of that is as a consequence of people physically going down to Melbourne for a couple of weeks and helping out, which is great, but a lot of it is jurisdictions surging their contact tracing team to help remotely with contact tracing in Victoria and do what we can to get on top of these outbreaks in that jurisdiction.
So that's just fantastic information for people, Vanessa. I think that's actually the most comprehensive look at contact tracing that we've done in this segment, and I think in a way that everybody's going to really understand. The message that we have and all health officials and members of the government have been making is that if you are tested for COVID-19 and you're tested, you have symptoms, then make sure you isolate until that result. We know how hard that is, and we know there's some delays down in Victoria at the moment because of the volume that's down there. But I think what Vanessa's elegantly shown there is the criticality of why you need to isolate, because if you're waiting for a COVID test and you end up being COVID positive, if you've been out for that 2 or 3 days, then that just makes the contact tracers work that much harder.
It really does, and we always breathe a sigh of relief when someone said, no, since I've been tested, I've been at home, and it's like, okay, we don't need to worry about those days.
Yeah, exactly right. Although clearly, the most important thing to say to a contact tracer is it's not a court of law, but the truth, the whole truth, and nothing but the truth, because that's going to be the most important thing that's going to help that disease detective with working out where those transmission chains are.
Yeah, absolutely no judgment in contact tracing land. All we need to know is, the best information to help reduce the risk of spread.
Perfect. What a great way to finish on today. Hope you've enjoyed that segment, and we'll see you again next week.